postural orthostatic tachycardia syndrome, and we'll be talking about how you can properly identify and manage this syndrome. So here are the learning objectives. After this lesson, you'll be able to describe the signs and symptoms of POTS, explain how POTS is diagnosed and identified, and identify management strategies for individuals diagnosed with POTS. Before I go any further, does anyone here actually have any prior experience to postural orthostatic tachycardia syndrome? An audio response would be nice because I can't see you guys.
Sorry, a little.
Little. Yeah, so POTS, it's a very uncommon disease or condition, I should say, in our world today. It's just now recently being more recognizable because now the education is out there. People are starting to learn where some signs and symptoms, how to differentiate from other similar diseases that have the similar signs and symptoms and present the same. So it's just it's starting to become more recognizable in the world today, especially in the world of athletic training. What is postural orthostatic tachycardia syndrome, also known as POTS? It's a disorder affecting blood flow that causes a number of symptoms when transitioning specifically from lying down or sitting down to standing up. And while there is no cure, there are many strategies to manage this condition. And this is the primary identifying factor when it comes to this disease. This condition presents the same as heat illnesses, and that's where it usually gets missed. We're in a environment where it's super hot, super dry, and then we have a patient faint or feel dizzy. We all know those signs and symptoms that correlate with heat illnesses. And in the moment, many people would say, yes, this is definitely a case of heat exhaustion or heat stroke, and then treat it as such. And although there are some correlations when it comes to initial management, when it comes to the long term, the diagnosis of POTS is usually missed because we are so focused on the presentation of a heat illness. Here are some signs and symptoms that correlate to POTS. The primary sign or symptom is lightheadedness, dizziness, or fainting. Because there's a lack of blood flow to the brain and certain extremities, many individuals feel, weak, lightheaded, because they're not getting that proper blood flow that they need to their brain to complete certain tasks. Another major symptom is fatigue. Like I said, there's a lack of blood flow to the extremities and to the brain. This causes people to not have the energy they need to complete simple tasks. This also correlates to headaches and migraines because they're not getting that proper blood flow and the nutrients that they need to their brain. Their brain is gonna, go through fatigue, and that's when the headaches and the migraines start to kick in. And this also correlates to cognitive dysfunction. Relating back to the lack of blood flow again, since they're not getting that blood flow that they need to keep the brain active, they're gonna go through cognitive decline during especially during exercise or during long days of standing around. And some other minor symptoms, they're not as common because this condition is usually diagnosed in a population that is not physically active. But in a physically active population that we are all in for athletic training, nausea and palpitations are very common if the individual does indeed have POTS, because they're already having a decline in blood flow to the rest of their body and their brain. So when they go through exercise or activity, they're pushing their body even further to the point where their body needs more blood circulated, but there's in the not enough blood in the first place. So they're gonna basically push their body to a point where they're gonna have heart palpitations or nausea. Although the cause for POTS syndrome is not pinpointed exactly, there are still some speculations or some theories on how this condition actually presents itself. The leading cause that research has identified is autonomic dysfunction. So, before I get deeper into that, it's important to identify that there is primary POTS and then there's secondary POTS. Primary POTS is, POTS is the actual diagnosis. Even though it is difficult to diagnose and the cause is not well known, using certain diagnostic options and getting a list of comparable signs and symptoms will help them reach a diagnosis of POTS. And then secondary POTS is they have a predisposing condition that basically leads them to developing a case of POTS. And we'll go deeper into that. But with autonomic dysfunction and genetics, they kind of go both hand in hand. You're born with some predisposing factors that causes you to develop this condition. And then when it comes to autoimmune activity, small nerve neuropathy, and low blood volume, those are what we would call secondary factors. So these three causes are usually related to some predisposing condition. So if they have a condition, for example, that causes low blood volume, then they're automatically going to be more predisposed to POTS. So it's important that everyone can identify primary and secondary POTS so they can differentiate, can we actually do something about this? So like with autonomic dysfunction and genetics, there's really, no major way of actually managing their signs and symptoms because it's something that they are born with. When it comes to autoimmune activity, small nerve neuropathy, and low blood volume, those are some things that we can actually manage through some sort of therapeutic intervention or some sort of lifestyle changes. And we'll get into some of those management strategies. How to identify. Luckily, when it comes to POTS, there is a very simple way to identify if someone has it. So what you would do is if you suspect that someone has POTS, you'll have them sit down and you'll take a resting heart rate. Once they get to a stable heart rate, you'll take note of that and then immediately have them stand up. And while you're still actively taking their pulse. And then after a minute or two, it's usually around 2 to 3 actually. If the person shows a increased heart rate of 30 beats per minute or more just by standing, that typically means that they have POTS. And then vice versa, if they go back to a resting position, whether that's lying down or sitting down, and their heart rate decreases, then that's basically just the same way of what we did before. And then another identifying factor is that these symptoms that we listed before, they worsen with heat or dehydration. And that's another reason why it's usually mixed up with the diagnosis of heat exhaustion or heat stroke.
Is there a preferred method of heart rate heart rate assessment? Like do you need to do it manually? Do you need to do it with like what is there a preferred method?
That's a good question. There's not a preferred method, although I would say getting some sort of heart rate monitor would probably be the best. That way you can get a more consistent measurement while they're going from the resting position to the standing position, because it could very well be easily missed. If you're taking, for example, if you're taking their heart rate from the wrist just by using your fingers, it would be very easy to lose a consistent measurement while they're going to that standing position, because of how awkward it would be to kind of hold that position of holding their wrist. So using some sort of heart rate monitor would probably be the best in this case. How to manage, like I stated earlier, POTS has no cure as of now. Like I said, it's just now starting to reach educational programs, and it's starting to be more recognized by clinicians, because that education is out there and the topic is out there. So we're going to go over some lifestyle changes that can help manage the signs and symptoms that are associated with POTS. The first one is increased fluids and salt intake. This will help increase the blood volume of the person that has POTS. And having that increased blood volume means that they're less likely to go into a state where they're not getting enough blood flow to their to portions of their body. And then compression stockings. This is a bit more of a controversial management strategy. It's kind of a hit or miss kind of management strategy. Some research indicates that it is beneficial to helping basically contain the blood flow kind to the upper body instead of to the lower extremities. But it has been shown in research that it's not always effective for certain individuals. Recumbent exercises. This is more of a long-term management strategy out of all the ones listed here. So when someone has POTS, it's important that they kind of condition their body. But like I stated earlier, conditioning causes someone to be more predisposed to the signs and symptoms of POTS. So to counteract that predisposing factor, it's important to have the patient start with recumbent exercises, as you can see in the bottom model. Having them in a seated position while also completing exercises means that they are getting that clinical outcome and increasing their strength and endurance while being in a safe position to prevent them from developing symptoms related to POTS. Then over time, once the patient feels more comfortable with themselves, they can progress further. And we can also, like I stated before, go to the resting position to the standing position heart rate monitoring. Once they get to a point where their increased heart rate has decreased substantially, then you would know that you could progress further into a more inclined position. And eventually, the goal of this progression is to get them into a standing position, whether that's treadmill or elliptical or just basic running. Another management strategy is avoid prolonged standing. Having someone with POTS standing in a prolonged state means that they're going to basically lose more and more blood flow to the upper portions of their body, and it'll start sitting more to the lower extremity. So it's important to avoid prolonged standing if possible. And then increased amount of sleep is also a management strategy that helps the person get the rest that they need and recovery that they need, so that their body can properly take the time that it needs to recover from the lack of blood flow that they've had to certain portions of the body. When they're in that lying position, the blood is going to evenly distribute throughout the body. And that's why it's important that someone with POTS takes the time during the day to sit down or lie down so that they can give their body some time to properly recover. So when it comes to POTS, early identification is key in the world of athletic training. And like we stated before, orthostatic vitals is the primary way of identifying POTS. And symptom comparison while in a lying position and in a standing position is also a key factor in the early identification of POTS. And then when it comes to management, although there's no cure, like I stated before, lifestyle changes and progressive exercise can help someone create a normal environment, although they have this condition. And that's very important to improving these patients' quality of life, so that they can, go through their day without this rare but simple condition. Thank you. Please ask any questions now. Feel free to ask me questions now. While we're here, I'd like you guys to scan the QR code. It's a little survey. It'll ask about your general experience with this condition, as well as kind of taking a benchmark measurement of like what you guys took away from this lesson. And also, I also asked for your feedback in there as well. It's very important to me that this feedback is honest, because I really like this topic. I've experienced this before with the patient before, and it was a long process. So getting this feedback will help me understand where I can improve my education on this topic. So thank you.